Hello and welcome. We're coming to you live from Malawi's capital, Lilongwe. In particular, from the National Organization of Midwives, Nurses and Midwives, the headquarters where we are being hosted by the owners of this place. They have received visitors, some I'm told from KUHES, others from the Royal College of Nurses in the UK, and yet more others representatives of the Malawi Union of Nurses, what are called MUNA. What is at stake is what they are calling development of a journal and research capacity for the Malawian nurse. A very, very pertinent discussion. Without much ado, I would like to pass the microphone to the host, the president of the Nurses and Midwives organization in Malawi, to help introduce the people that I have on this panel. My name is Patrick Njawala. I'm hoping you make time to be with us.
So I am Shaut Simeza, President for the National Organization of Nurses and Midwives of Malawi, NONM. So we are at our headquarters in the Lilongwe area 13. And we have visitors amongst us. We have from a distance, my farthest distance is Professor Joy Nota from the Birmingham City University. And next to her is Professor Genesis Chorwe from KUHES, but he's here in his capacity as the chief editor of the Malawi Journal of Nursing and Midwifery, which is a product of the professional product of NONM. And next to him is essay from the Royal College of Nursing. And then next to her, somebody closer to me here is Salah. And so Salah is from the MUNA. MUNA is a Malawi UK Nurses Association.
Yes.
Yeah. So if I were to wrap up the introduction, we have colleagues from the Birmingham City University. We have KUHES, but particularly from the editorial board of our journal, the New Birth. And we have Royal College of Nursing, our old friend and partner. And then we have MUNA. These are nurses from Malawi, but based in the UK. So they formed their own association, and they are in this partnership with us. That should be the introduction that I may make for now.
Thank you so very much, and thank you for that detailed introduction. The issue that you're raising and why we are here is the development of a journal, but also research capacity for nurses. Kindly provide a background. Why is that important that you should have a medical journal, particularly for nurses? We have known of journals, but that are doctors mostly. And then also the other issue, the issue of research and capacity building for nurses. Why is that important? Why should we be focusing on that here in Malawi? And why are you also bringing in international players?
Great. So thank you so much, Patrick. A quick introduction about NONM and why we've gone that far of establishing or starting a journal is that we are a professional body, but also a trade union. So we look at and we advocate for and we lobby for the welfare in terms of professional and socioeconomic interest of nurses and midwives in Malawi. So we speak on behalf of nurses and midwives. We speak on behalf of the nursing and midwifery professions. And that's where now I would want us to dwell on and leading to the development of a journal. So we're not talking of lobbying and advocating for the nursing and midwifery profession. One pillar in our strategic plan is the issue of professionalism. So professionalism and professionalization indicating the growth and development of the nursing and midwifery profession here in Malawi. And so, in the process of professionalization, we also noted that there are so many things that nurses and midwives are doing in terms of service provision, and all innovations that are associated with service delivery, but are not well published and established for the society to appreciate. And that is what led us now to say, okay, fine, can we have a space so that we start now publishing, what we are doing, and those nurses that are doing research to provide the evidence-based service and care. We needed to find them a space for publication so that the public and the consumers of their services should appreciate. We are talking of new trends coming in. We are talking of advancement of the nursing production, nursing as a service. All that we needed to be known and be published to the society, be in Malawi, national, regional, and global. And that's the birth of the journal. So why international colleagues is that when we had a launch of this journal in August 2024, so we had set an editorial board, which is chaired and presided over by Professor Genesis Chorwe, who is with us here. We have the team, it is here, already working very hard on the journal. So issues of capacity building and moving together and growing together, we noted that our colleagues, especially the Birmingham City University, are doing quite good in terms of journal management and governance. That's why now we reached out to the Royal College of Nursing, and they identified for us a very experienced Professor Joy, who is with us here. And so Professor Joy and Dr. Chris Carter is inside there. They said, okay, fine, let's find a date in a week, and this is the day. They have all the editorial team members together with us, look at the journal, where we are now and where we want to go. So today they were working on the trajectory of where we are heading to. And MUNA, Salah from MUNA, she's been there in terms of the organization, because recently we also had a very critical nursing activity. We evaluated the nursing leadership project with support from the Global Health Initiative. So in this partnership, we are growing the journal, but building capacity on each one of us here, both locally as well as globally. Yeah. Thank you so very much.
Professor Joy, I will come to you. I will jump the other members that are in between. The shouts here is saying that you're doing well in area of journering in Zambia, where you've been operating, but also elsewhere where you have been doing this. What differences have you seen since you started this work? And why should we in Malawi now adopt it? What benefits to the provision of healthcare?
I am a nurse by background, and I'm proud to be a nurse. And I noticed in the UK, nurses were very good at what they did, but they didn't write it down and they didn't tell anyone. So nobody knows the evidence base and the collection. So I was asked to set up British Journal of Nursing with a colleague, and that journal's been running now 20 years, and it is a very well-used journal. But what I learned from that is that for nurses to get the confidence to publish what they do, they need a journal that is specially for them, that's led by nurses, and that who will support and guide them as they work. So when the RCN said, would Dr. Chris and I be willing to come out, I was delighted to come, and so was he. We want to see nursing take its rightful place. The doctors can do their best, but they must have nurses that have knowledge and expertise to work with them. So complementary. And therefore the opportunity to work with the professor here and get the journal to the point where he can say our nurses too are leading the care forward. It's the nurses that are there 24 hours a day, 7 days a week, and the nurses are the ones that therefore need to show what's needed. And we've been made so welcome, and I think Elsa and everybody has made us feel part of here, and it's an honour and a privilege to be asked to come. We are one community, nursing is one international community, and we have to stand together. And I have learned just as much here from the people here as they could ever possibly learn from me. It's bi-directional shared learning, so that's why I'm here.
Thank you so very much for your detailed answer. Some takeaway messages. You're saying you're looking at capacitating nurses to be as knowledgeable and get expertise so as to be able to work better with the doctors, but also with the patients as they provide the service. And in this part of the world whereby you do not even have that many doctors, the patient-doctor ratio is not there. Nurses are completely key, and for many, the nurses is the closest thing you're going to get to any medical intervention.
Can I just say,
yes, please.
Nurses are autonomous professionals in their own rights.
Yes.
They have an extended role here that is amazingly impressive, I think, and I'll hand to my colleagues on that. And I want to see them as a right to take their place. So we've been working in Zambia. There we've capacity built critical care, because Dr. Chris is Associate Professor in Trauma and Critical Care, and we've taken them from an advanced diploma and they're now studying at Master of Science level, which means they can anticipate what the patient's needs. They can do the extended role safely, and they can work alongside their multidisciplinary team, but they have a role of their own that is essential, and so that's really what I feel. And so I think it's amazing to see how fast your nurses here are growing. And we went yesterday to the hospitals, and the nurses are doing such good work, but they're not telling anyone. So
it warms my heart to hear that, because I know what you're talking about. Maybe not many people do know. Often we hear people complain about perhaps an interaction that they had with a nurse and it was negative, but those are isolated incidences. There are many, many great stories that need to be told. We are making a lot of headway in reversing health challenges in this country. Things like, for example, in dialysis care, specialist nurses there, even ophthalmology. The nurses there are doing critically well. So it does warm my heart to hear of this initiative. Professor Joy, you are the one that has come in. You're coming from KUHES, but you are on this grouping in your individual capacity to provide editing services. Yes. Journaling. From a medical, from an academic perspective, very, very important. But I cannot even imagine it in the health sector. It's as crucial as it should be. Why is this important for the Malawian nurse? But why is it also important for the health sector in this country?
Thank you very much to give me this opportunity to share information regarding Malawi Journal of Nursing and Midwifery, and I should thank also the Nurses Organization of Malawi for appointing me to be their first chief editor for the journal, which is in making. As it has already been said that nurses need to take their rightful place. It is really true, because nurses are doing a lot. They are not just providing care in various settings, but they also generate knowledge, which inform the provision of care. Now, that knowledge is generated through research, but also by doing some quality improvement projects, or just through provision of care. some kind of knowledge is generated. But that knowledge, if it is not documented, then it disappears. It doesn't benefit the profession, it doesn't benefit the masses, it doesn't benefit the future generations. So, this journal is timely in the sense that it is going to provide an avenue where nurses are going and midwives are going to publish their work or the kind of knowledge they have generated. Yes, one would argue to say there are already other journals out there where nurses can publish, but I'll tell you that there are several reasons why it is difficult for our nurses locally to publish elsewhere. One, there is a lot of competition, like pressure. If they say we send it to journals which are UK based, which are American based, it means the whole world is submitting to that journal. So it is by chance or luck that your work as a nurse will be published. But also, the journals maybe might charge article publication fees, which are very expensive. So you find that the nurses will not be able to submit because of the issue of the cost. But the other thing is also about the equity in scientific publication. You will find that most of the information which we have is published in journals which are in high-income countries. So you find that the information generated in settings like Malawi, low and middle-income countries, they don't find space in those journals. Now, what it means, the knowledge which is generated locally here might not be available in those journals. And also those journals might not be easily accessible by our local audience because we have published elsewhere. So the current journal of nursing and midwifery which we are working on, it is going to make it accessible for our policymakers, our students, and even the nurses in practice to access the information which they can also associate with, because this will be locally generated information or evidence to inform the local kind of practice. So the other good thing is that since around 2005 or thereabout, Malawi started training nurses at the master's level and the PhD level. So these are research-based kind of programs. And you find that through these trainings, a lot of research is generated, which has to be published. So we have a lot of master students who are nurses who have to publish their work. And this information is very important for Malawi in terms of policy, practice, and even to inform training. So the journal, Malawi Journal of Nursing and Midwifery, is that such kind of an avenue where the students are going to publish their work.
Dr. Elsa, you would allow me to jump you. I come to her, then I'll come to you. We'll talk about the Royal College of Nursing. But I would like to, from the point Genesis has made, I would like Sarah to come in. Sarah has had, she's Malawian, but right now working in the UK. So she is privileged in that she has experienced this too. In the UK, the nursing profession is well established, and it has been there for many, many years. So well established, a lot of work going there. That explains why, for example, you now have people like Elsie working at an international academy from the Royal College of Nursing. Kindly give us an experience working as a Malawi nurse, but also in your present capacity working in the UK, how these things differ, but how also there may be similarities and how perhaps we could create a symbiotic kind of relationship.
I think first and foremost, what Joy said, that nursing We are one family as nurses globally, irrespective of where you are. And I have seen that in the UK and here in Malawi. And I do have that privilege. I'm actually working with the Royal College of Nursing, and I am a Malawian nurse. And for me, I'm at the right precipice because I can support both in both spaces. And what I have seen is that as nurses, we have the same concerns and we have the same desires, and our core desire is to be able to do our job well. And to be able to do your job well, you have to have the capacity, you have to be supported to be able to deliver the care to the high standard, which gives us satisfaction because that's where we find our satisfaction. And in my role and what I have experienced in the UK, I mean, I've been able to publish with renowned publishers because that process is easy. I can network, I have access. And then working as a Malawian nurse there, we have partnered with NONM. We've done some research, like we were talking about around leadership and the impact of early career nurses and leadership, where we noted, oh my goodness, there's so much learning. But then where do we put that information that we have learned from? And now this is where that discussion is going to say, we have done a piece of work, a piece of research, how do we share it? We can share it, yes, in our international journals, yes, but how can we share it in Malawi? Because it's about us. And what this journal is giving us ownership and the autonomy to run something for ourselves. Because over the years, what we have noted and seen is that Malawi is very patriarchal. So our healthcare system is the same, it's medically led. And nurses tend to come behind. But what we're trying to do is to pull a chair to the table to say, here we are, acknowledge who we are, and we are competent, we are autonomous, and we can input new knowledge into healthcare. So what I see across the board is the biggest difference would be resources, capacity and access. But as nurses globally, we have the same desires and we have the same wants to just be able to do our job well.
Before I come to Elsie, a takeaway message from her, we are competent as nurses, and that is very true. A case in point would be, Charles, you would agree with me, there was a time I think we have we had Dorothy Ngoma.
Yeah, Dorothy, yes.
She was heading the Safe Motherhood.
Yes.
And you look at what happened during her tenure of office. Yes, because she was coming from a background where she understood, but then she had been given at a table where she could lobby and make decisions. So it just points to what can happen when you put the right people in the right places. And nurses are the people that should be given that table. Royal College of Nursing in the UK, the nursing profession has been there for hundreds of years. There's a lot of wonderful things that are happening to a level now that you do head a position of head of international academy. You are looking at nursing not just within the UK, but I'm told that you are in places like Gaza, Myanmar, Zambia next door, and many, many other places. Why is it important that we look at nursing and the welfare of nurses, not just in the UK, but beyond the borders?
It's a very good question. And first of all, it's a privilege to be here, surrounded by really expert nurses, global nurses. And I would start by saying that all nurses are global nurses. At the International Academy, we believe, first, it's the Royal College of Nursing has a Royal Charter, and in that Royal Charter that was created almost 70, 100 years ago, it stated that we should support nurses in the UK and beyond. So we are beyond.
Great.
And it's because if there's something that COVID has taught us, is that whatever happens on the other side of the world will quickly come to us. And we live in a globalized world. Borders are there merely by chance. Exactly. And nurses move a lot, and the population moves a lot. There's a lot of migration, there's a lot of, so the health problems, the social problems, the geopolitical problems are there, and nurses are at the forefront of that. And we all have a responsibility with each other. We are a big family, a big global family, and the knowledge that all nurses have across the world needs to be shared. And if there are places where nurses have the privilege of having the resources, the capacity, they also will have challenges, but if they have that privilege, then it is our responsibility to share that. And more than that, we have the responsibility to learn from each other. Because what COVID also taught us, at least in the UK, and that was a very deep experience that we had, and that we have shared as Royal College, is that when things got really tough, what really made a difference were the almost 30% of nurses who are not trained and not born in the UK. Because they have this breadth of experience, because they are used to environments that are low in resources, and they have to do the best they can with what they have. And this is a really important, these are really important skills. At the International Academy, by recognizing this, we also recognize that nursing has a wealth of expertise, and nurses are clinical experts, academic experts, they have cultural expertise, and we have to harness all of that if we want to make a difference. So we surround ourselves with people who have that expertise to make most impact. With NONM, the relationship came from years ago. There's a long-standing relationship between the RCN and NONM, started back in 2007, I believe. And then that relationship resumed in 2024 with a program by the International Council of Nurses. And when we first met, it was very clear that there was a strategic plan for the organization. And even from a distance, we had never met until this week. It was, well, actually, we met in Helsinki a few months ago, but we hadn't come to Malawi. And it was very clear that the organization knew exactly what the workforce needed. They have a clear idea of what are the streams that will enable the nursing workforce to be well established and to fulfill their potential. And amongst other issues like leadership and nursing well-being, which are major issues, the issue of nurse-led research came across as a really important one. And when we heard about the establishment of the Malawi Journal of Nursing Midwifery, it all made sense. Right. And when we reflect on the age that we live in, the age of AI, and we talked about this many times, where everybody accesses AI and we're all very scared about AI. There's a lot of opportunities in AI, but there's one big challenge, which is AI is only as helpful as the information that it gets from the sources that exist. And if we don't have any information from all parts of the world, particularly around healthcare, then the decisions that we're going to make are not accurate, depending on where you are. If most of our data is coming from the US, from the UK, from France, from people who look like me, then that's not going to be applicable to the majority of the world.
That's true.
And then I'll add something else to that, which is nursing. Yeah, we're all nurses, and we know that nursing is the biggest proportion of healthcare workers in the world. So by proportion, we should have the biggest voice. We should be the ones generating more knowledge, more evidence. You've said that nurses are in places where doctors aren't, and that gives them these, and that generated that need for them to have these expanded roles.
Yes.
Yet we don't hear from them. We have visited yesterday a few hospitals and district and central hospitals. And I was absolutely amazed at what the work that nurses are doing, and they're doing it and they're not even acknowledging how much they're doing. The nurse leaders I've met yesterday would make any nurse in the UK proud of the nursing profession. And I think that Malawi has to be really proud of their nurses.
That is true. That is true. Now, talking about where you've been, because part of your mandate here is to look at areas of research, but also development. You're very right in saying that what the nurses do here, they make every tablet count, every piece of it. what they perform are short of miracles, literally. You be like, how can somebody operate, deliver babies in this kind of environment? But they're miracle workers, seriously. Now, the unfortunate thing was, over the couple of years, we've seen, in search of greener pastures, nurses migrating to Europe, for example, or those that have opportunities, they'll go study and maybe even stay there. But and a lot of resources are being put in. I do not know what it is that whether you have looked at areas whereby maybe capacitating, and I know he's coming from Kuhes. In the past, before even Kuhes and College of Medicine came, doctors used to be trained in the UK. But simply by establishing the College of Medicine in Malawi, it significantly made a difference. Of the budget that goes towards training doctors significantly reduced, and more doctors have been trained over the years. Is this the same? Are you thinking like that in terms of nurses? Are we thinking that sooner or later we're going to train more, but also in specialized areas? You mentioned masters, PhD level, specialist, critical care levels of nursing.
If I could come in there, I mean, first of all, I think NONM had the vision to try and move things forward and should be congratulated.
Right.
It's
Drink to that?
well, I think they've led incredibly well. Malawi is very special, and I've worked in capacity strengthening now for over 20 years, but we work for the long haul. We're not here to do parachuting, do a project and parachute out. The aim, and one of the reasons why I was so happy to be invited to come, is because we all share, the three organisations share the same aim. I'm trying to make myself redundant. I'm actually, where I work, the project is never mine, belongs to the country in which I work, and I am the invited guest and privileged. I'm a child of privilege, I openly admit that. I actually trained in Florence Nightingale's training school. So the tradition of service was there from the day I first started. But the emphasis is, you are one, as we said, one family, one community. And if you have something, you must give it, you must share, you must give back. And we went to the ministry on Tuesday, and it was impressive, the commitment they have to bringing nurses on and to making it work. And that's what nurses have always needed. And you're right, we followed the doctors. But it's partly because the doctors had to take the lead at the beginning, but with the help of the professional organisations, and as Elsa has said, and Sarah and Charles, it's changing. And what QHERS have done in a very short time, when I was talking to Professor Genesis, it's amazing how nurse education here is moving. And one of the reasons the UK poaches your nurses is because they're good. And I'm sorry, we shouldn't take them, but they are known to work hard and to be good nurses. And as you said, everybody wants the best for their community, and so they try to find ways. And my hope is, as if the nurses get recognised here and accepted, and specialisms are accepted, they won't want to go elsewhere because they'll get the job satisfaction and the respect here.
I've heard it said that an act rewarded will be repeated. So if we reward our nurses, they'll be inclined. After all, it makes a lot of sense to serve your community, your people, and there's that inner satisfaction that is there. Sometimes going beyond borders is a desperate act, but what does one do? KUHES, are we going to? What should we be doing to ensure that we bring in excellence to people that are already motivated? Because I've heard that you need to motivate people, but I believe nurses, people become nurses because they are already motivated. But maybe our task should be to ensure that we do not demotivate them. What are we doing, or what should we continue doing, or what are we not doing?
Yeah, so I think I'll speak more on what we are doing. Yeah, if you look at nursing training in Malawi, generally it was focused on a generalist kind of a nurse, a nurse who can do everything. That's what Malawi needs. But you would see that like in another field, people will still have something which is very close to their heart, or which they are compassionate about. So nursing is a very broader profession. You can focus on caring of the children. You can focus on caring for elderly, and so many other areas. You mentioned about people with kidney problems, people with the cancer problem. So we have all those specialized areas of nursing. So as indeed one way of motivating nurses is to give them that opportunity that they can work in the area where they feel more comfortable. Okay, so that is now available. As UHES, we are training nurses in various fields: adult health, child health, pediatric critical care, emergency and trauma care, mental health, so on and so forth. And these programs now are at a graduate and postgraduate level. So to motivate the people or the nurses is that we have made it possible that they can see their career path. When they enter the profession, unlike in the past, maybe 20 years ago, where you get into the profession and for you to get another qualification, you are thinking of going abroad, which was very difficult. But now, locally you can get a master's degree, locally you can get a PhD, and that motivates the nurses to say, okay, well, I get into the profession, but I can grow in within the profession and locally. And that motivates them. And again, the recognition, as colleagues have already said, when nurses are acquiring higher qualifications, they are being recognized. For example, recently now, the government, through the Ministry of Health, recognizes nurse specialists. So a nurse who has acquired a master's degree, for example, in the field of mental health nursing, will be recognized as a mental health nurse specialist, which is a very senior position. And this is not an administration or a management position. It is a clinical practice kind of a position, which never existed before. So you will see that the nurses now are able to see their opportunities when they are in clinical practice. So those are some of the incentives which through or motivation through COHES that we are supporting the government initiatives.
Brilliant. Sarah, you stand in that privileged position, having been in the two worlds. What is an ideal in the health sector? And the same question I'll ask Shouts here. When you look, what would be an ideal setup for healthcare in Malawi, but with emphasis on the nurse? What would be that day when you look at a nurse or what is happening within the nursing industry and you say, wow?
If you're asking me for a wish, where there is a nursing voice in spaces of decision making, so that where people recognize and acknowledge the importance of that nursing voice. And I think for me that's the ultimate, because everything that we see and what happens in practice is based on the decisions that have been made. And what we have been seeing for so long is that decisions are made for us and not with us. We're not being invited to the table. We have to drag chairs by ourselves into the table. We're kicking down doors. We're forcing ourselves in. But we want to be given that opportunity just to sit at that table so that we can comment. So for example, I understand that Malawi has signed a bilateral agreement with the US around healthcare for so many billions of tranches. And that means that they'll be planning for the next 5 years around that budget. Where is the nursing voice in that? That is my question.
It is a good question.
So if that's my ultimate, that's what I would like to see, because once we get our nurses in there in leadership positions, it will cast cascade. It's a domino effect. It will cascade. And that's what I would like to see for all our nurses, because it's about giving all nurses equitable access and opportunity. They have to be seen, they have to be recognized, and we have to be heard.
I'm hoping conversations like the ones that we're having will snowball into something bigger, and that we'll start seeing action. The former president of Malawi, Dr. Lazarus Chakwera, used to say, and I like that quote, "Nothing for us without us." I'm hoping there will be nothing for the nurses without the nurses. Let it come from the bottom, and then we'll go up. I'll give you the last word. You're the host.
Yeah, thank you so much.
Yes.
So I totally agree with you. Let me start with that statement. Nothing for us without us. Nothing for nurses without nurses. So I agree with the Sarah's contribution or submission here. That you know, she's combining, as we are putting it. She has an experience of the nursing domain here in Malawi at the UK. So the lack of our involvement in decision making, that one disadvantages us big time. So as an organization, we are looking forward to a time when we have a well-motivated nursing and midwifery workforce, where positioning of, feeding of decision-making or policy-making positions are on that. Because in terms of preparation, you would agree with me. If not, then I'll share that in terms of preparation, nurses in Malawi are well prepared, as Professor Jennings mentioned. It's globally. When you read the ICN, WHO, nurses, the system, be it the government or any employer will be saying, okay, I'm appointing a nurse on merit to head this, including the position of the Secretary for Health. The Secretary for Health position can be well managed and handled by well prepared, qualified nurses. We have them here in Malawi, capable, and they can do that. She mentioned about the big funding that has come in this agreement with the US. It is going towards maternal and other health services there. We recently had the Directorate of Reproductive Health in the Ministry of Health, headed by the nurse. And in fact, for the past 15 years, that position has been headed by a nurse midwife. But we've noticed that lately, a few months ago, the nurse was removed and replaced by a cousin professional. Those are the frustrations.
Yeah, that you're making 10 steps.
Absolutely. So going this way, we're coming back. And we are, as nurses and midwives, the backbone, as was already said, and we're talking now universal health coverage 2030. It is clearly mentioned that no nation, no country, let alone Malawi, will achieve the universal health coverage by 2030 without positioning the nurses and midwives in decision-making responsibilities.
I would like to thank you so very much. My ideal is a time when nurses who are at present unsung heroes become celebrated and become role models. I would like to take opportunity of this time to thank you all for the wonderful work that you're doing. You are at the moment unsung heroes, but on behalf of the crew that I'm working with, and perhaps the media in Malawi, we will strive to ensure that we give you podiums, but we also celebrate the successes that you are doing, but also lobby for those things that you need. You can count us on that. In the interim, continue doing the wonderful work that you're doing, although there's not that much applause, but you're doing wonderful work. Someone said the fact that you cannot see the sun does not necessarily mean the sun is not there. So you are shining, continue shining. You are the stars. And dear viewer, thank you so very, very much for making time to listen to this exciting conversation that we should actually be having. It warms my heart to hear of the wonderful work that is happening, but also about the ideals of what is possible. I have had an opportunity of working with a wonderful crew. Peter Piri was my producer. We had Temonan Manjoe. We also had Don't make me, Maranatha, I'm not going to forget your name. A wonderful team that I worked with. So I'm so overwhelmed. I have been your host. My name is Patrick Njawala. Continue watching MIBAWA Television. Bye for now.